Hey ladies, did you just start taking birth control pills as a contraceptive or hormone imbalance treatment and are all confused on how to take them? And you have questions that why your pill pack has two different colors, when to start it and when to stop it? Well, don't worry. By the end of this video, you will know everything you need to know on how to use your birth control pills. So let's get started. Now remember, there are two kinds of contraceptive pills: combined oral contraceptive pills, which are also called COCs for short, and progestin-only pills, also called POPs for short. Each kind has different hormones, so if one kind doesn't suit, you can always have the option of the other kind. But before you make that switch, make sure you have used the medicine for about 2 to 3 months, because sometimes your body may take up to 3 months to adjust to the hormone changes and side effects caused by the medication, like nausea, vomiting, feeling bloated, tenderness of the breasts, and a few others. If you take birth control pills or you are thinking of taking them, you are a part of a large group, because the pill is the most popular contraceptive choice among American women. And why not? It's convenient to use and is one of the most reliable ways to prevent unplanned pregnancies. In fact, the contraceptive pills can block 99.7% pregnancies in women, meaning only 3 out of 1,000 women will get pregnant, which is pretty awesome. But the key is you must take it effectively, and when taking contraceptives, timing is super important. But first, let's see why oral contraceptives are used. Well, oral contraceptives, or commonly called as birth control pills, are not just used to prevent pregnancy, but are also used to regulate your menstrual cycle. Also, certain brands of contraceptive pills may be used for treating acne or PCOS, or as a morning after pill for emergency contraception. So before starting these pills, make sure you consult your doctor or pharmacist to discuss if this is the right treatment option for you, because it is not recommended in women with certain conditions that I will mention later in this video. Another very important thing to remember is that the use of this medication does not protect you or your partner against sexually transmitted diseases like HIV and gonorrhea and many others. Now, who can take contraceptive pills? So, of course, first of all, once your doctor has verified that you're not already pregnant, you can get on the pill at any time, any age, unless otherwise suggested by your doctor. But if you are close to menopause, then discuss with your doctor or pharmacist if it might be better to take a mini pill, which is 1 hormone instead of the usual 2, and the hormones are in lesser amount. Now let's see who cannot take the pill. The contraceptive pills may not be right for you if you are over the age of 35 and smoke, have a history of stroke, heart disease, circulation problem, or breast cancer. You have started breastfeeding within the past month, or are having migraine headaches with aura. You have diabetes related issues like nephropathy or neuropathy, recently had a surgery, had a liver disease, or have unexplained uterine bleeding. Now, once everything goes good, you have unchecked all the conditions I just mentioned, you can now start your pill. But wait, are you confused on how to take it? Well, don't worry, I'm gonna clear all your confusions you have. So let's take a look at the pill pack. Okay, so this is how most of the pill packs will look. You see how all of these pills, the top 3, are different colors, and the bottom one in the last row is a different color. Now, this color coordination is not done just to make it look pretty, but in fact, the color here is a distinguishing factor between the active pills, the top blue ones, and the non-active pills, the bottom row. Active pills, meaning they have the actual hormone in it, the blue ones in this pack, and the inactive pills, also known as placebo pills or dummy pills, and they are the ones in the green right here in the bottom row. They are just black. meaning they have nothing in them. A lot of times. But sometimes they will contain iron supplement. So you may think, what's the point of having these pills if they have nothing in them? Well, basically, these pills are there to help you stay on track. So when you're done taking the active 21 pills, all these blue ones right here, you're going to get your period. Then you take, like on the day 1 of your period, you take the inactive pills for 7 days, which basically is like taking a gap of 7 days from your active hormone pills, because if you skip the placebo pills and start the active pills right away, that would eliminate your period as well. You have several ways to get on your pill. The first one is the first day start, which means take your first pill the day you get your period. Pregnancy protection kicks in right away in that case. So you don't need to worry about the backup contraceptive because the medication kind of kicks in right away. Another way is quick start. You take the first pill in your pack right away after you pick it from your pharmacy or medical store, wherever. This is an option if your doctor confirmed that you're not already pregnant and are not on your periods. So in this case, the hormones in the pills need time to build up in your body. So you'll need a backup contraception for 7 days. Third, very common way to start your pills is Sunday start. Now many pill packs are arranged to start on this day. You take your first pill on the Sunday after your menstruation starts and use a second birth control method for 7 days if you have sex. Now this method basically times your menstrual cycle in a way that your periods do not start on the weekend, which I guess some people prefer because they would rather relax on the weekend and spend quality time with their partner. So once you have picked how you want to start your pill, then remember to take your pill at the same time every day, especially if you are using progestin only pill, because that's literally unforgiving, meaning it has a smaller margin of error than regular combination pills with both estrogen and progestin hormone. And remember, you can take your pill with food or immediately after food to prevent upset stomach. And side effect wise, this medication may cause dizziness, headache, lightheadedness, which will go away once your body gets used to of the medication. Now it can also cause upset stomach like bloating or nausea, vomiting, which is why I recommended to take it with food. Now if you experience anything other than that, do contact your doctor or pharmacist, as it could be something serious. Birth control pills work extremely well to prevent unintended pregnancies, but that really depends on sticking to your pill schedule to keep your hormone levels where they need to be to block contraception. So if it's been less than 48 hours since the time of your last pill, take the late or skip dose right away. Then take the rest of the pills in your pack on your regular schedule, even if it means taking 2 pills on the same day or the same times. Normally, that's a big no-no in pharmacy world. If you miss a dose of any other medication, we normally tell patients to skip that dosage and return back to the normal dosing schedule and kind of monitor the symptoms. But this is one exception. In the contraceptives, if you miss the dose, you take it as soon as you remember, even if that means doubling up the dosage, because otherwise you may have an unexpected surprise you're not ready for. Okay, so now I'm back with my phone one more time because I want to address some of the most commonly asked questions that many of my patients have on the use of contraceptives. I have them all written down in the phone because I want to make sure that I don't miss any of them. So kindly bear with me as I open the questions. Where is it? Here you go. Okay, so let's read the first question. Do birth control pills cause weight gain? That's a very commonly asked question and a point of concern for many women because many women think so. But studies have shown that effect of the birth control pills on weight is small if it exists at all. Instead, you may be retaining more fluid, which can make you feel as if you have put on weight. But there are some combined pills that contain the hormone progesterone, which decreases bloating and does not cause weight gain due to water retention, because it's a diuretic. So if weight gain is your point of concern, then consider switching to that. Alright, let's see. Another very important question is, I have taken birth control pills for years and want to stop. Can I stop at any time, or should I finish my current pill pack? In terms of your overall health, it makes little difference when you stop taking the pill. Now, when you finally do stop the pill, do expect that you may get some bleeding, which may change the rhythm of your menstrual cycle. But you can stop it at any time. You don't have to wait for your pill pack to end. Okay, so the next up is, can antibiotics decrease the effectiveness of birth control pills? So I think the effects of antibiotics on birth control pills may be a little overstated, except in the case of rifampin. Rifampin actually does decrease the effectiveness of birth control pills, but this antibiotic isn't widely used. However, if you want to be super cautious, always check with your pharmacist or doctor about the possible interactions of your antibiotic with the contraceptive, because better safe than sorry. Alright, so that concludes my today's video. I hope this really helps simplify the use of contraceptive pills for you. But if you have questions or any confusion, don't hesitate to ask in the comments. And if you find value in this video, please like, share, and subscribe now to stay up to date on new videos on health and pharmacy. I'll see you guys next time with another awesome video. Until then, take care. Bye.